difference is that this one, the illumination comes from above to strike on this inclined mirror and reflect on your patient's eye. While the Ziggs type, the illumination or the light comes from under. Another difference between the Ziggs and Hack rate is that the Hack rate has a knob to change the magnification, while the Ziggs has a lever here to change the magnification. So this one, this is the magnification knob for this one. While the Ziggs, that one within my office, the magnification knob they under here. Another difference that would be the third one is that the Hack rate has about 5 magnification, while the Ziggs has only 2. So this one, if you check here now, you see 6x, 10x, 16x, 25 and 40. It's still the same calibration here for the mag. So this one has about 5 magnifications, while the Ziggs has only 2, 1x and 1.6x. So these are the 3 differences between the Ziggs and the Hack rate. Now for the parts, slit lamp is divided majorly into 3 equal parts. It's divided into just the way it ticks now. It's divided into 3. We have the mechanical system, which has to deal with the position and adjustment of your patient. We have the observational system that deals with the observer or the examiner, this particular part. While this one has to deal with anything concerning light source and illumination. So this is the illumination system, the observational system, and the mechanical system. So under the mechanical system, we have the forehead band. If your patient is to put his or her chin here, the forehead must rest here. If it doesn't rest here, you will not have a proper focus of your patient's eye. So the forehead must rest here, while the chin must properly align here. So this is the forehead band, this is the chin rest, this is the chin rest. This one is the canthus alignment. Before you start your examination, your patient's lateral canthus must align with these 2 things here. So this is the chin rest adjustment knob. This one is part of the mechanical system too. This is your joystick. This joystick works in 2 ways. It works in taking the slit lamp sideways and also bringing the slit lamp up or down. Let's say for instance the light is focusing here. You can use it to bring the light on the center of the patient's pupil. Now we have the slit lock. This is the slit lock. This one helps to lock the slit lamp so it will not be moving around. That's why this one works on. This is the slit base. This is the friction plate. This is the motorizing table. This one is the friction plate. This is the motorizing table. Then we have the on and off switch. This is the on and off switch. So any technique that you are asked to perform or set on a filter or whatever, you must on the slit lamp. Whether they give you a patient or not, you must put on the slit lamp. So for the mechanical system again, we have the table height adjustment. This is the table height adjustment. These 2 things. So I think there's no other thing regarding the mechanical system. I think we're all good with this one. Now we have the observational system. For this observational system, I said earlier that it has to do with the examiner. Now before you start, we have the eyepiece. This is the eyepiece. This is the mark ring. It's calibrated. This is the mark ring for correcting the examiner's refractive error. This is the prism housing. This stuff here houses the prism. This is the prism housing. This is your magnification. This is your objective lens. This stuff here is your objective lens. Now this stuff here, before this stuff, the focusing targets, they asked somebody this thing last Viva. This stuff is called the focusing target. What this stuff is used for is usually mounted here. It's usually mounted here. Now what this stuff means is before you start examination on a slit lamp, this one is not for Viva. Before you start examination on a slit lamp, you have to first of all adjust for your refractive error monocularly, not binocularly. You put this eye here. Check for clarity. Use this thing as a target. You'll be adjusting it until it becomes very clear. Till it comes into focus. Then you also look through here. Before you now view binocularly. Let me if you understand what I meant. So this stuff now is called the focusing target. Instead of using your hand to check when it's clear, you better just use this stuff. That is what this stuff works for. Okay, part of the mechanical system, we have this stuff, our fixation targets. While this one is the focusing. This one is the focusing target, this one is the fixation target. So I think I'm done with the observational system. Now we have the illumination system, we have the light source, this is our light source. We have the filter control or filter knob, this is the filter knob. Now we have basically 3 types of filters. We have the white filter, we have the red free filter or the green filter. We have the cobalt blue or the blue filter. So these are the 3 types of filters. So all these ones here, it reduces the intensity. This one is the white filter, it's on the highest illumination. I've reduced the intensity already. If your patient is photophobic, you reduce the intensity. And the white filter is used for just general gross overview of the anterior segment. While the red pre-filter or the green filter is when you are checking for blood vessels, hemorrhages, vascularities with rose bengal. That is when you use this red-green filter. While the cobalt blue is used with fluorescent dye to check for corneal scars and aberrations. Then also used with applanation tonometer and also used to check for tear breakup time. So that is what the blue filter is. Now we have the slit height. This is where the slit height for this slit, and this is where the slit height control is, or slit height knob is. This particular one here. Then this one here you are seeing here is the slit height scale. This thing you are seeing here. As you are adjusting this slit height, you'll be seeing the numbering. The slit height, the highest here is 14, while the lowest is 0.2 for this slit, and the highest is 14, the lowest is 0.2. So we have again we have a slit angle scale. This is a slit angle scale. When it's here on 90, the light is like this. There's something they used to call the slit beam. I don't know how many of you have heard about slit beam. So this is where it should be on something like this. Then the height should be elongated like a slit. It should be elongated. So this is a slit angle scale. If I should place it like this, the light will now be horizontally placed. If I should place it like this on 90, the light will be like so. This is just having different angles of the slits and width. So we have our inclined mirror. This is our inclined mirror. There is a mirror here. This is our inclined mirror. Let me if you pass seeing it. So this is our inclined mirror. So this is our diffuser for performing diffuse illumination. This is our diffuser. That is when you make use of this stuff. You raise it up, meaning that it's on. So this is our decentering screw, or what we call the sclerotic scatter. This stuff here. Then we have our slit width. This is our slit width control or knob. It's calibrated. The highest here is 20, the lowest is 0 for this slit width. Then we have our rheostat. This stuff here is called our rheostat. They can on the slit lamp can be on and they'll off it from this place. It can be on there, but they'll off it from here. So if you on the slit lamp and put your hand there and it's not coming up, you have to adjust the rheostat. So this thing can also be called light intensity control, or you call it the rheostat. Then we have this one here to be our slit illumination system lock knob. This stuff here, if you lock it, this stuff will stop moving around. Why this one is called the observational system lock knob. Then this place you can mount your fundus camera here, you can mount your applanation tonometer here, this particular pin. You can also mount your focusing target here as well. Then the other associated instruments to gonio lens and ruby lens, but that one you hold it. That one is not being mounted. That one you hold it. So I think that is all for the parts of the slit lamp. So now we'll be going over to the illumination techniques. Now we have about 10 to 8 illumination techniques, or even more than. I call this one the observational system. Now we have about 10 to 8 illumination methods or techniques. Now the first one, we have the direct illumination techniques and the indirect illumination techniques. Now under the direct illumination techniques or method, we have about 6 of them. They are 6 in number. We have the diffuse illumination, we have the parallel pipe, optical section, conical beam, specular reflection, tangential illumination. Then under the indirect, we have the sclerotic scatter, we have the retro illumination and oscillatory. The Van Herrick, I think that one is on its own. Now for the diffuse, when you are doing diffuse illumination, you just want to have general overview of the eye. You just want to see how the ocular surface is. You are not trying to look for anything in particular. You just want to check if the eye is healthy. So now that one has to make use of the angle. The slit angle is 45 degrees. It can be 45 to 60, but mainly 45 degrees. So remember, before you start anything, the slit lamp has to be on first before you start any technique. So your slit lamp is like this. So you take this one 45 degrees away. You take it 45 degrees away from this one. So there is a calibration here. There is a calibration here. This 30, 35, 40, this 45. You lock it so it will not be moving around. So you lock it on 45 degrees. So the next thing now, for this diffuse illumination, you on your diffuser. This diffuser only works with diffuse illumination. You on your diffuser. Then when you must have on it, your slit width will be on the widest beam. And the widest beam here is 20. Some people confuse this into the 2.0. This thing is 20. You put it on 20. Then the next thing you adjust this your rheostat to the highest intensity. Because once you put this your diffuser, the intensity of the light will reduce. So you will increase the intensity. Then the next thing is your magnification will be low to medium. When you are putting it on high mag is when you want to view a particular, so just like you're pressing you are doing video, you zoom to see something. So this one now you are just having a gross overview. So the magnification will be medium, low to medium, from 6 to 16 f's is where your magnification will be if you put it on 6, 10 or 16. So that is for diffuse illumination. So is there any question here? Now the next one is the parallel pipe. So now for parallel pipe, it's still the same angle. It's still the same angle of 45 degrees. Still the same angle of 45 degrees. Now for the parallel pipe, this slit width will no longer be on the widest beam, and this diffuser will no longer be here for all the techniques. It's only diffuse illumination. All the techniques, nothing concern you and this diffuser.
Sorry. Is it when you raise it up?
It's on. When you raise it up, it's on. When you it's off. So for parallel pipe now it's 45 degrees for the angle. Then the slit width will now be 2 to 4 millimeter. It doesn't exceed 4 millimeter. It doesn't go below 2 millimeter for parallel pipe. So you come to your slit width, put it on 2 millimeter. Then the next thing you're going to do now, your magnification will now be medium to high. Because parallel pipe now helps you to, let's say you saw a foreign body, it helps you to have a magnified and detailed view of that foreign body. Instead of that light dispersing, the light will not be centered on that particular foreign body or sky you want to examine. So your magnification will now be medium to high to help you to appreciate the foreign body very well. So this parallel pipe is used for checking for corneal layers, depth of foreign body aberrations, scars on the cornea and the rest of this. So any question on these ones we have talked so far? Now the next one is the conical beam. Sorry, the optical section rather. Optical section is just a thin light from the parallel pipe, meaning that it's 1 to 2 millimeter. Optical section doesn't go beyond 2 millimeter. It doesn't go below 1 millimeter. Why parallel pipe doesn't go below 2 millimeter? It doesn't go above 4 millimeter. So optical section is just a thin light from that parallel pipe. So 1 millimeter is okay for optical section. So you come there, reduce your light. If your light was bigger, it will become smaller. You put it on 1 millimeter, still the same 45 degrees as the angle. Then your distance will also be medium to high. The only difference between optical section and parallel pipe is that what parallel pipe did not help you to see, optical section will help you to appreciate it better. Because that light now will not be focused more on that particular structure or particular abnormality you want to view. Instead of the light being, I don't know how to explain it, just that the light will be centered more on that particular structure instead of you having a view of other things that is not exactly that structure you want to see. So parallel pipe and optical section has the same uses. They have the same use, corneal layers and the rest of them. Now the next one is the conical beam. Now the conical beam is exactly how you did your parallel pipe. The only difference here now is you come to your slit height. Now you adjust your slit height to form a conical shape. If the slit height was on 14, which is the highest, you reduce it to 1 or 0.2, which is the lowest. So when the light is like this, you reduce it so it will form, when the light is being compressed, it will form a kind of circular shape that is conical. So that is the difference between the parallel pipe, conical and optical section. So if you are doing conical beam, you are setting it as if you are doing parallel pipe, but you come to your slit height and reduce the height to have a conical shape. Now the conical beam, you are checking for aqueous flex, aqueous cells in the anterior chamber, and you're checking for the lens surface as well. I think the anterior lens. So is there any question so far? So basically, most of these techniques makes use of 45 degrees. Make use of 45 degrees, and most of them too, outside diffuse illumination that makes use of widest beam, which is 20. Most of them too makes use of 2 to 4 millimeter, and outside optical section that makes use of 1 millimeter for the width too. So is there any question?
For that conical beam, you see the magnification is what?
For conical beam, I think the magnification should be medium to high as well, because it will help you to have an in-depth view of what you. If you use low mag, you won't see the anterior lens. You won't even see the aqueous flares very well. So it's medium to high or high mag. Now the next one is specular reflection. Now for specular reflection, that is one that doesn't make use of 45 degrees as the angle. Specular reflection now, let's just keep this lamp like this for specular reflection. Now from the definition, the angle of incidence is equal to the angle of reflection. So this is the, let's assume this is the incident angle, this is the angle, this is the incident, this is the reflected one. So let's this one now, we'll take this one to 30 degrees away from this one. When you move this one 30 degrees, you place it on 30, you lock it, then move this one too. Now you move this one too. This one now is locked, it's not going to move. The one moving now is this one. You take this one 30 degrees again away from this one. So leaving this one on 60. Is that clear? When you move this one 30, this one now you move it 30 degrees. This one you move it 30 degrees away from this one, then this one move it 30 degrees away from this one. That will leave you at 60. For this one that will be on 60, this one will be on 30. So they are 30 degrees away from each other. Are we confused here? So it's 30 degrees away from each other. So for this specular reflection, the slit width will be on 2 to 4 millimeter as well. The slit width will be 2 to 4 millimeter. So maybe you can check the uses of this specular reflection. But I know that it's examining the lens as well. Is it in your notes?
Corneal deuterium, lens surface,
It's
access
examining the crystalline lens. So it's 2 to 4 millimeter for the width, just that 30 degrees apart from each other for specular reflection. Then the next one is tangential illumination. Tangential is the one that makes use of 90 degrees. Tangential, you just take this guy to 90 degrees. Where is that lighter? You take this one to 90 degrees. For tangential, this one to 90 degrees. And the thing is still 2 to 4 millimeter. That reminds me, this stuff is called the latch to tilt the slit column. This stuff here. This one is the latch holder. This is the latch to tilt the slit column. So this one here is the latch holder. So this one is for tangential illumination, it's 90 degrees. Now we have the sclerotic scatter. For sclerotic scatter, the sclerotic scatter is in your notes. It's 45 degrees, right? Sclerotic scatter is 45.
It's 45 to
5 to 60, so it's 45 degrees. Then also 2 to 4 millimeter, which is the width. 2 to 4 millimeter, 45 degrees, 2 to 4 millimeter. So for that sclerotic scatter, I think it also checks the corneal layers and the rest of them. The light will be incident on the limbus. Now you come to this your decentering screw. If it's locked, you have to. I think this stuff is in contrast. I've not really noticed, but I think it helps to give sharpness to what you are viewing also. So whenever you're performing sclerotic scatter, after setting it up 45 degrees, 2 to 4 millimeter for the width, you have to touch this your sclerotic scatter or decentering screw. Then we'll have the Van Herk technique. That one now is the one used to estimate the anterior chamber depth. They might not ask you to perform Van Herk technique. They might ask you to perform or set it up for a technique for estimating the anterior chamber depth. So it's the Van Herk technique and makes use of 60 degrees. It makes use of, you set your angle 60 degrees. And the light now is going to be incident on the limbus to cast a shadow. So is there any question?
What should be slit?
Hmm?
Slit width for
It should be 54 millimeter.
You say the slit width for
On average, it should be 54 millimeter.
So
Now there's
almost all is 2 to 4 except the optical
optical
section.
section, except to for diffuse and widest beam, diffuse illumination, and optical section. Most of them is 2 to 4 millimeter. Then there's something they call perfocality coupling effects,
yes.
whereby the scope is corresponding with the. I don't know if it's like this, that perfocality, where the light is incident is corresponding with the microscope. I think is it like this, like as if a spectral reflection, something like this. So there's something. I think it can be like this, because if you observe now the microscope, this is the microscope now, this is the microscope now, this is the light source, corresponds with the who can remember the definition?
You see the coupling effect, the point at which the microscope is focused corresponds with the point at which the light is focused.
It can also be like this, I think so. Then there's something they call slit beam. I think, do you know what that slit beam is?
Like,
If they ask you to identify the slit
that was
beam.
my level question. Like, from what we see that is inside, like, there's how you're going to position it. It's going to be like straight. That is what he
For
told
slit
me.
beam, if they ask you to position the slit, or if they ask you to identify the slit beam, you have to put your hand here first. Then the light should be like a slit. Because if you are doing optical section, the light now will be conical. So that thing is not that one is conical beam. If they ask you for conical beam, that is that one when you are doing conical section. Now for slit beam, the light has to be elongated, just like when you are doing parallel paths. So that is what they mean by that slit beam. So is there any question? I think we are done now.
You call this thing, you call this thing.
Latch to
Latch.
tilt the slit column. Latch to tilt the
What
slit
is
column.
this?
I don't know what that thing is.
You don't know.
Which thing?
How do you do that?
This thing. Who's that? There's something like that.
That's last night. Yes, it's high and follow.
No, if you don't really, before you start any technique, you on the slit arm like I said, then put your hand here to ensure that the light is coming out. Put your hand here, and if you don't want to put your hand there, or you're sure that the light is out already, this thing is calibrated. This thing is calibrated. When it's on 14, it's on the highest. It's on 14 and it's on the highest. So with this 14, you can do your parallel pipe, optical section, diffuse, other techniques. But when it now comes to conical beam, you have to reduce it to the lowest, either 1 or 0.2 to the lowest. It will have a conical shape. So that slit beam too, it should be on 14. It should be on 14. The angle can be anyhow you want to place it, but let the slit be straight. So is there any question? I think we are done.
When the radio starts.
Maybe I'm not the man.
No, I think if it's on, let's take the radio start. If light is not coming on.
If it's on and if the light is on, check the radio start. Sometimes the radio start can be on, but the slit width, if the slit width is on 0, the light will not be on. Do you understand? So you just have to adjust the slit width small. Sometimes if the height is on the lowest, on the tiniest light, you don't notice so you just have to rotate the down.
Does this candles alignment? Alignment.
It's on alignment. How?
Give me alignment.
You use this thing to align it. As you're moving this, the patient's head is coming up or coming down, so align with this. I'll just align with this. This one is your chin rest adjustment.
Go ahead, go.
That one is your table height on and off switch.
So this thing is off now, I can't even raise.
No, you can't raise it. If it's off, you can't raise it. If it's off,
What is the principal?
That thing now is for this stuff. This thing, you can carry out this slit lamp from here. You can take it off from here.
And
This thing is just mounted.
function.
This table is just mounted.
Like if you pull out this table,
Yes.
it's two functions.
The wire is just connected. See these wires now, it's just connected to that switch. It's not this table.
Let me see.
Wow.
The couple and
You see, the one that reflects on the iris, you call it
Van Herrick.
But it's just like shadow test. Just like shadow test, but it's letting the anterior chamber depth.